Welcome to the Holistic Plastic Surgery Show, where we dive deep into the hottest trends in health, beauty, and cosmetic treatments. I'm Dr. Anthony Yoon, America's holistic plastic surgeon. Gender reassignment is a hot topic in plastic surgery today. Although tens of thousands of transgender men and women are undergoing invasive procedures every year, there is very little public information about these operations. So on this episode of the Holistic Plastic Surgery Show, I'm joined by one of the country's foremost experts in transgender plastic surgery. We're going to demystify the process and answer such questions as, what are the requirements for someone who's transitioning? What surgical steps must a person go through to transition? How much do hormones change the body? And has he ever had a patient regret undergoing transgender plastic surgery? This is an extremely important and relevant topic today, which I think will expose you to a world of plastic surgery you may not have known much about. So let's get started. My guest this week is a double board certified plastic surgeon with an MD from Temple University School of Medicine. He completed his residency in general surgery at Robert Wood Johnson Medical School, a fellowship in hand and microsurgery at the University of Miami School of Medicine, and then attended Duke University Medical Center for his plastic surgery training. My guest has been in private practice for 7 years in Beverly Hills, California. He specializes in body contouring and breast procedures, but dedicates a large part of his practice to gender affirmation procedures. My guest is a member of the American Society of Plastic Surgeons, the American Society of Reconstructive Microsurgery, the World Professional Association for Transgender Health, the American College of Surgeons, and the International Society of Plastic and Regenerative Surgeons. I'd like to welcome my good friend, Dr. Josef Hadeed, to the Holistic Plastic Surgery Show. Thank you so much for coming on the show.
Thank you for having me.
All right, well, you have been treating a lot of transgender patients in your practice, and this is something that I find really interesting. Now, for those of you who don't know and haven't met Dr. Hadeed, he's very active on social media, on Instagram, on Twitter, and we met at a meeting recently for the American Society of Plastic Surgeons, and one of the super hot topics at this meeting was transgender surgery. And so I was really interested in having you come on the podcast today because I think this is such a hot topic, something that's so relevant to so many people. But let's start by asking you how you got into being a plastic surgeon for the transgender community.
Well, you bring up a very good point, actually. Even as recently as a few years ago, most plastic surgeons, at least myself included and others that I know, didn't really treat any transgender patients. Certainly, it wasn't something that we were exposed to during our surgical residency training. And I first came about it because I started seeing transgender patients coming into my practice, and they were asking for various procedures. And at the time, I didn't really feel comfortable treating them. And that's due mostly in part to the fact that I just really wasn't exposed to this patient population, as well as some of the surgical procedures that they were asking for. So I took it upon myself, actually, to look around and see who was offering these procedures. And I was surprised to find that not a lot of surgeons, especially in the United States, are offering transgender surgical procedures. And this is back in about 2013. So I kind of took it upon myself to go to Europe, actually, and I've been to Europe several times. I reached out to several plastic surgeons that are there that are well known in the field and asked them if I could come and observe them for periods of time, and they were very open to it. And what I learned when I was in Europe is that it's such an interesting aspect of plastic surgery. First of all, you're obviously helping people that are needing help, and it's a very neglected demographic. But also from a technical standpoint, a lot of these procedures, I think, really combines a lot of the basic surgical skills that we learn in residency and applies them. And when you think about it, you're transforming someone's body to make them look more masculine or more feminine. So for me, it was more of a challenge, and I really thought it was interesting and wanted to learn as much as I could about it. So that's what prompted me to get into the field.
So then if somebody is transitioning and they're considering plastic surgery, what are some of the requirements that they need to meet before actually going under the knife?
Great question. So not any person who's transgender can have transgender surgical procedures. There are some requirements, and WPATH, which is the World Professional Association for Transgender Health, has published standards of care that are meant to guide healthcare professionals that are treating transgender patients to help optimize them prior to surgery. So, for example, if someone is interested in having surgery or undergoing surgical transition, some of the requirements are that they have to have a persistent and well-documented gender dysphoria. And gender dysphoria is a feeling of not identifying with one's gender identity at birth. And this has to be documented from a qualified mental health professional. The patient has to have the capability to make a fully informed decision and to consent for treatment. If there are any medical or mental health issues, they have to be reasonably controlled at the time of surgery. And then finally, the patient has to be of the age of majority in the country in which they live. And so in the United States, for example, they have to be 18 years old, although there can be some exceptions made for a minor on an individual basis.
So then how long, I know one of the things that they do is it's the idea of living as the opposite gender, the gender you weren't born with. Is there a certain period of time, 6 months, a year, that they're required to live as the other gender before they undergo these surgical procedures that will obviously permanently change their body?
So for most surgical procedures, the answer is no. For bottom surgery, which is the general term used for genital surgery, it is recommended that they live in the role for at least 1 year, 12 consecutive months. For some U.S. insurance companies, they do look at older standards, older requirements, which did require them to live for a contiguous period of time as a member of the opposite sex. However, with the current standards of care, it's not really so much of a requirement.
Mm-hmm. So what's everybody's story is a little bit different when I'm sure they come into your office. And, as you mentioned earlier, this is definitely a group of people that are in our society that have, there's been a lot of bias against them. There's been a lot of people who don't, really understand what it's like to be in their situation. Obviously, there's a lot of bullying that are involved. When you see patients in your office, are there any, how would I ask this, are there any factors in their life that seem to be pretty consistent? So when people come in, do they seem to come in a similar situation, or is it really quite different? I mean, do people come in and they say, hey, I'm ready, let's have surgery, I know that this is what I want to do? Is that kind of what you see, or are there still people coming in who may be a little unsure, of whether they're doing the right thing? What stage of mind are they in when they actually come to see a plastic surgeon?
So typically, by the time they come to see me in the office, they've already undergone appropriate mental health counseling and therapy. By the time they come see me, they usually have a letter of recommendation from their therapist, which states that they do have gender dysphoria or gender identity disorder, that they've had it for a specified period of time. And then the qualified mental health professional will state that, in their opinion, the patient is ready to undergo surgical transition. So as a plastic surgeon, I typically see them when they're ready to have surgery towards the end of the process. It's rare for me to see someone at the very beginning if they're thinking about transitioning or if they're thinking about having surgery. I typically won't see them. Occasionally, somebody will come into the office just because they're curious about knowing what their surgical options are. Mm-hmm. Maybe they're not necessarily looking to transition surgically right away, but they just want to know what their options are down the road when they decide that they finally want to have surgery.
So I know you do mainly surgery, the top surgery, basically, so facial as well as breast and abdomen and stuff. Do you have requirements yourself then when the patients come in? I mean, is that something where then if somebody comes in and you consult with them and say, okay, this is the information, these are the procedures, but if you are going to undergo this, then do you send them to a certain person? Is there an expert that they see, whether it's a mental health professional or their family physician? Who would somebody who is, let's say, they believe they're transgender, they're having issues, and they want to change their gender, they see you, where would you send them to as a next step?
So if they haven't seen anybody else prior to seeing me, I would send them, first of all, to a mental health professional. And there are a lot of resources, especially in Los Angeles. The LGBT Center in LA is a great resource. and I have a good working relationship with them. And I do send a lot of patients over to them that maybe are at the beginning stages of the transition. A lot of patients find me online and they just think that they could come in and have surgery, and they're not really aware of the necessary steps that are a prerequisite in order to have surgery. I do make sure that they see their primary care physician as well. A lot of times the referral has to come from their primary care physician. And before we have surgery, we want to make sure that they're medically optimized as well. So typically I do have them see their primary care physician for a medical clearance prior to surgery.
Are the patients that you're performing surgery on, do they typically have a good amount of family support? Is that something that you see a lot with, or have you seen a lot of patients who maybe have lost the support because maybe the family doesn't quite understand what they're going through?
I've seen the whole spectrum. So some patients have tremendous family support. Other patients, unfortunately, don't have quite the same level of support from their family. So you do have to treat every person individually. At the end of the day, you're treating the patient and not the family. It's nice to have family buy-in and family support. I have had, for example, spouses, parents, siblings come in that are very, you could tell right away, they're very, very supportive of the patient. And conversely, I've had family members come in that you could tell they're somewhat aloof, they're uncomfortable, maybe not so supportive of the patient.
Have you had any blowback for it? Any people who have not liked that you're performing these surgeries?
It hasn't come up. Although, being in Los Angeles, it is a fairly liberal society with a large community, large transgender community here. So I have not witnessed it to date. I do know that some biases and prejudices exist out there, unfortunately, but it hasn't been an issue with my practice so far.
All right, well, let's kind of switch over and let's talk about the actual procedures. So if somebody comes in and let's say they're going male to female, and they say, hey, look, Dr. Hadeed, I'm transitioning male to female. What would be my first step? And can you kind of, go step by step of what patients typically go through procedure-wise in order for them to completely transition?
So it's an interesting point. So when you mention completely transition, not every patient wants to completely transition. I think a lot of people think that if a transgender person is changing their gender identity, that they're going to want to have everything done. But the reality is that gender dysphoria is very specific between each individual. And really what you want to do is address the parts of the body that are contributing to the gender dysphoria for that person. For example, somebody may decide that their face is what gives them gender dysphoria. If they're biological male and they're transitioning to become a female, maybe it's their high forehead that's giving them gender dysphoria, or maybe they have a wide jaw. Maybe they want to have a breast augmentation. And it really varies from person to person. So it's not really a one-size-fits-all approach. I think it's very important to sit down with the patient and discuss what their goals are and what they hope to accomplish. And then formulate a surgical plan that will help the patient achieve their goals. But for the sake of argument, let's assume that somebody does want to do the full transition. I start from the top and move down, and I say, is there anything about your face that you don't like? And there are a lot of differences and characteristics between the masculine and the feminine face. For example, men tend to have higher foreheads, a receding hairline, a ridge above the brow. The nose tends to be wider and straighter when looked at the profile. Men have wider jaws, maybe a more prominent chin, and of course an Adam's apple as well. So these are all things that would have to be addressed. Moving down the body, of course, giving breast implants would give the appearance of having breast. There are various body contouring procedures that could be done as well. For example, a tummy tuck, liposuction. Sometimes some men that are transitioning to become women want to have buttocks augmentation. This can be accomplished with either implants or fat transfer. And then, of course, there's the big surgery, which would be the genital surgery and creating a new vagina.
Mm-hmm. Now, how much do the actual hormones that they take care of a lot of this? Because ideally, one of the things that I'm always I always preach to my patients and to people who follow me is to use actual surgery as a last resort. And so how much of this do you find that the hormones really can take care of a lot of it?
So the hormones can actually do a lot of amazing things for the body. From a feminizing standpoint, a lot of individuals will notice an increase in their breast size, for example. This is somewhat limited, and realistically, the largest increase on average is about a 1 cup increase in breast size. I think the most striking example of hormonal changes is actually in women that are transitioning to become men from the testosterone that they're on. They start to grow a lot of hair, especially in the facial region, the chest, the arms, the legs. Sometimes their voice actually gets a little bit deeper. And you'd be amazed at how many individuals you'll see, especially those that are on testosterone, where you look at them facially and they look like biological males. But then when you examine their body, of course, you see the female characteristics. So you can achieve some degree of transition just from being on hormones. And for some individuals, that's sufficient. That's what they want. They just want to look or have the appearance of looking like the opposite sex when they're out in public. They don't necessarily want to have any surgical changes to their body.
So then now kind of shifting gears from going from female then to male, what are some of the procedures, if you're looking at a complete transition, that they would consider?
So again, starting from the top and moving down, we can actually set the hairline back to lengthen the forehead. We can put implants in the forehead or fillers to give the appearance of a ridge above the brow. We can put implants in the nose to make them look bigger, to make them look straighter, and also to widen the nose. We can also put implants in the jawline to give a wider appearance to the lower third of the face. And believe it or not, we could actually augment the Adam's apple area to give the appearance of enhanced thyroid cartilage.
How do you do that? What do you, is it filler you just use for that, or do you actually, is there a type of an implant that you can actually put in?
So there's no, to the best of my knowledge, there's no specific surgical implant, but you could actually do a cartilage graft. So taking cartilage from the rib, for example, and then putting it into place in the soft tissues just above the thyroid cartilage to give the appearance of an enhanced Adam's apple.
Will that move like a normal Adam's apple will with swallowing and things?
To a certain extent.
Really? Oh, interesting. Okay, so we hit the neck, and now keep going on down.
So for the chest region, we would perform a mastectomy to remove the breast tissue. But it's also important to note that there are some nuances between doing a mastectomy for breast cancer and doing a mastectomy for someone who's transitioning. We do, after we remove the breast tissue, want to reshape and recontour the chest to give it a more masculine appearance. Likewise, we can also do various body contouring procedures to change the shape of the torso. And then probably I would say the most challenging surgical procedure as it relates to transgender surgery is actually the genital surgery, going from female to male. And the most common method is to actually use the tissues from the forearm to create a new penis and then move those tissues down into the pelvic region and actually create a functioning phallus.
Wow. Yeah. And now, are those surgeries being done a lot here in the U.S.? I know you've traveled out to Europe to be trained in a lot of it. And when we spoke, you said you're not quite doing a lot of the underneath, basically, the genital surgeries yet. When somebody wants that, is there somebody in town in LA that you send them to, or do they actually go out of the country?
So there are not a lot of surgeons in the United States that are performing these procedures. In fact, if I'm not mistaken, maybe to date about 24 or so surgeons in the whole country. And a lot of times patients will either go to Europe or South America or Asia, in particular Thailand. They've been doing these types of procedures for over 30 years. A lot of other countries and continents are actually a lot more advanced than the United States is as it relates to transgender surgical procedures. And I know that a lot of surgeons in the United States already have wait lists for the bottom surgeries of, over 2-3 years.
Wow. Are there any pitfalls that patients should consider, and even physicians? I I don't do transgender surgery. I have had requests for it, and it's not that I've turned anybody down. It just hasn't come into my office. But are there any pitfalls that the surgeons who are listening to this or patients who are listening to this should be aware of? So for example, let's say doing a breast augmentation in a male, transitioning to female, the nipples are not in the same location in men than in women. They're a little more laterally located. They're more off to the side. And that's something that needs to be put to the attention of the actual patient so that they don't think that it's going to look exactly like a female breast augmentation. Are there any tips or words of advice that you give regarding that, trying to avoid, let's say a surgeon, oh yeah, you want a brow lift? We'll just do a brow lift on you like I do on all my other patients. How do you change some of these? Are there any changes to these procedures that with your experience you need to do that maybe the average surgeon doesn't know?
So I think although the basic surgical principles are the same, there are some differences in terms of the technique. And I think, first of all, it's very important, like with any surgical procedure, to set the expectations with the patient right away and tell the patient that there are limitations to what can be achieved. Obviously, everybody's anatomy is going to be different. Everybody's characteristics, physical characteristics, are going to be different. So it's, I think, very important, first and foremost, to sit down and have a very thorough discussion with the patient and tell them realistically what could be achieved, what can't be achieved, set the expectations right away. And then from a surgical standpoint, you're right. I mean, you can't just do a brow lift and say, oh, you're going to look like a male or look like a female. You have to take the patient's individual anatomy into consideration. And there are differences, and I'm going to use like breast augmentation, since you brought it up earlier as an example. When we do a breast augmentation in women, typically, we go over the muscle or underneath the muscle, let's say. For women for men that are transitioning to become women, their pec muscle is a lot bigger and thicker than it is in a biological woman. So that has to be taken into consideration. Are you actually going to go underneath the muscle? Is it really going to conceal the implant too much? Is it better maybe to go over the muscle if they have a really thick pectoralis, well-developed pec muscle? I mentioned earlier in this broadcast doing a mastectomy. Well, it's not just a matter of removing the breast tissue and closing the skin like we do in a woman with breast cancer. We really have to shape the chest afterwards, give the appearance of having a masculine chest, a well-defined upper torso. And a lot of it is where we place the incision line. So there are some nuances that I would suggest need to be taken into consideration when we do these procedures.
And for somebody who's transitioning, how would they find an appropriate plastic surgeon for themselves? Because once again, I've had patients call my office for appointments, and we don't turn anybody down. It's just they haven't necessarily, we just haven't gotten many of those calls. But one thing that really, I think at the meeting I learned a lot of, and talking with you previously, is just the amount of support that is necessary to really properly treat these patients the way that they need to be treated, And I almost liken it, and this is a very different situation, but cleft lip and palate surgery. When we had trained and our the people who came before us had trained, plastic surgeons were doing everything. So they would do a cleft lip, in the morning, and then in the afternoon they may do a tummy tuck, and then after that they may go to the burn unit and do burn surgery. And our field is getting much more specialized because of technology, because of improvements in surgery. And so one thing that really I think that I realized at this meeting was just the amount of nuance that is necessary to really give transgender patients the treatment that they need. And it's not as simple as, hey, just pick a board-certified plastic surgeon and they'll help you transition. That's not, doing a straightforward breast augmentation on a patient is very different than doing a patient who's transitioning. So do you have any advice for those patients to how do you find a good plastic surgeon if you are transitioning?
So I'm going to backtrack for a second and actually start with the physician. And as you alluded to, there was a time where plastic surgeons would do the whole breadth of plastic surgery, but it is becoming more specialized. And I think especially with the transgender field. It really is a multidisciplinary approach, in my opinion.
And real quick, that's kind of I didn't finish my thought. I say it, but that's the idea with behind now, like cleft lip and palate surgery. You don't just go to your neighborhood plastic surgeon to have that repaired. You want to go to an actual center
Absolutely.
where they've got speech therapy, they've got pediatricians, they've got all these people there who are involved, and so you get the absolute best care. And really, that's what it needs to be with transgender patients as well. So I'm sorry to cut you off there, but
no, not at all. That's an excellent point that you bring up. So I think it's very important from the plastic surgeon to develop good working relationships with various primary care physicians in their area, especially the ones that see a lot of transgender patients, to have good working relationships with mental health professionals, with endocrinologists, with social workers. And it really is a team approach. And I think, like a lot of other things in healthcare, when you have a team approach and everybody's on the same page, you really help to optimize outcomes for the patient. So I think for any surgeon that's considering getting into the field, I think it's important before you even see your first patient, just to reach out to other healthcare providers in your geographic area and try to develop good relationships with them, because you're going to have to send patients to see them and vice versa. So you want to make sure that everybody's on the same page. Now, when it comes to patients, I think one of the big challenges that patients have is they don't know where to turn to. And a lot of them, and I think part of it is due to the fact that not a lot of plastic surgeons are offering transgender procedures. So I think it's important for patients, when they reach out to a plastic surgeon's office, is ask the front office staff, how much experience does the surgeon have? Where did he train or she train? Where did they get their experience from? Do they work with other transgender plastic surgeons? Do they work with my primary care physician or my mental health therapist? And for patients to go even to the WPATH website, has some resources on there which can help them find plastic surgeons that are WPATH members, which means that they've at least had some training and qualifications to do these procedures.
So that may be kind of we always say find a board certified plastic surgeon, but to find a WPATH certified or a WPATH member surgeon is probably a first place to start, instead of, let's say, opening up your local glossy neighborhood magazine and picking out whoever has the biggest ad for breast implants or something.
Absolutely. And one of the things that I've noticed too is a lot of patients in this population, they communicate with each other via online chat rooms and forums. And I think that that's also a good resource for patients, is just to go on and find surgeons in their geographic area, just by virtue of asking others that have had procedures done. Who have you gone to see? Are you happy with your results? Before and after photos is important. Like with any other plastic surgery procedure, patients want to know what they could reasonably expect to look like after surgery. But it is a big challenge for patients, I think, right now, especially since 2014 is when Medicare decided to approve a lot of these procedures. And after Medicare authorized it, a lot of these private insurance companies started offering these as covered procedures as well. So I think my suspicion is that as the years go by, more and more plastic surgeons are going to get the requisite training in order to offer these procedures. And it's going to become easier for patients to find qualified plastic surgeons to do these procedures for them.
And what's the long-term follow-up for these patients? How long do you follow them? And then do they continue, I'm assuming, following up with their mental health professional? And do you know how long then they follow up with them?
So it's a lifelong process. It's not like they have surgery and then that's it. They're free from any further treatment. Seeing their mental health professional is going to be an ongoing process, as well as following up with their primary care physician. Interestingly, one of the things that we have to consider with transgender individuals is that there are health-related issues that are not going to go away just because they had surgical transition. And I'm going to give you a couple examples. For a biologic male that's transitioning to become a female, and let's say she has the full transition, has the vagina created. Well, when they remove the penis to create the vagina, the prostate gland is still left behind. So they will need to be on lifelong surveillance for their prostate gland, especially as they get older. They're going to have their PSA levels checked. They're going to have digital rectal exam to check for their prostate. For a biological female that's transitioning to become a male, some of them have their uterus and ovaries removed, others don't. So ovarian cancer screening is going to be something that's going to be important. Even when we do a mastectomy, there's still a less than 1% chance that they could develop breast cancer down the road. So lifelong surveillance with their primary care physician is going to be very important for this patient population.
And this is an interesting question that I know I've heard people talk about when they talk about transgender and transitioning. But have you ever had any patients who've regretted transitioning?
I personally have not had any patients that have regretted transitioning. In the literature, there is about a 1 to 2% reported incidence of regret after surgical transition. But I think that belies the underlying importance of making sure that when somebody's ready to transition, that they have seen a mental health professional with appropriate documentation of gender dysphoria.
Well, this has been super informative. His name is Dr. Josef Hadeed. His website is josefhadeedmd.com. Now, he spells the first name is Josef Hadeed, HADEED, josefhadeedmd.com. He's very active on Instagram, on Twitter. He's got a Facebook account. Very, very popular, especially on Instagram. So definitely take a peek at him. Can you give a word of advice, just kind of closing out this interview, that a tip for people to remember once they're finished listening to us today?
Absolutely. I would say for any surgical procedure that you're considering, make sure you're doing it for yourself and not for other people, because at the end of the day, it's your body, and carefully research the credentials of the provider that you go to. Always make sure you see a board-certified plastic surgeon.
That's great advice. Well, we covered a lot of really fascinating, great information today. I want to thank you, Joe, for coming on the show. I think that this is a topic that really needs to be discussed, and we really demystified, I think, a lot of kind of the plastic surgery aspects of it and the medical aspects of it. It's been super helpful.
Well, it's been my pleasure, and I really appreciate the opportunity to come on your show.
So once again, his name is Dr. Josef Hadeed. He's in Beverly Hills, California. He's a private practice plastic surgeon, board certified. His website is josefhadeedmd.com, josefhadeedmd.com. Find him also on Twitter and on Instagram. Thank you so much. My name is Dr. Anthony Yoon, America's holistic plastic surgeon, and this is the Holistic Plastic Surgery Show. We'll see you next time. Do you want to look 10 years younger without having surgery? Well, my best-selling book, The Age Fix, will tell you how. I spent the past 17 years learning the secrets to turning back the clock, and have written all the best of these secrets in this book. This includes the Age Fix diet, simple changes to what you eat that can make a huge difference in your appearance. I'll share with you a simple skincare routine to keep aging and wrinkles at bay. And I'll share with you the best secrets to treat every single beauty and aging problem there is, from age spots to wrinkles, saggy skin to bad breath, saddlebags to hair loss. And almost all of these can be effectively treated without surgery. So are you ready to turn back the clock and kick Father Time's backside? If so, check out The Age Fix. Now, if you purchase it on my website, dryoon.com, you'll get over $10 off the cover price, free shipping, and you'll receive several free gifts, including a bonus chapter that you can only get by purchasing the book there. Thank you for making The Age Fix such a huge success.